So, what is Wuchereria bancrofti? Wuchereria bancrofti is a crippling illness called lymphatic filariasis. It's brought on by the nematode parasite Wuchereria bancrofti and is spread by mosquitoes. It causes chronic swelling in bodily areas like the legs and genitalia by infecting the lymphatic system. It's a serious issue for public health, particularly in tropical areas. So now we can see the life cycle of the Wuchereria bancrofti. So Wuchereria bancrofti and Brugia malayi are both mosquito-borne parasites. Both have two important morphologic forms, the adult worm and the larvae, called mycofilariae. The adult male is usually the size of the female worm. Both are thread-like in appearance with creamy white color. The microfilariae have a delicate transparent covering called a sheath. Humans acquire the infection through the bite of a mosquito vector. The infective larvae migrate to the tissues, mature and localize in the lymphatics, subcutaneous tissues, or internal body cavities. Migration of the parasites exhibit periodicity, where the parasite is present in the bloodstream during specific times of the day, which corresponds to the feeding schedule of the mosquito vector. Migration may occur at night, during the day, or with no clear-cut timing. Wuchereria bancrofti is distributed throughout the tropical regions of Asia, Africa, China, the Pacific, and isolated locations in the Americas. The distribution is closely tied to the presence of its mosquito vectors, which are most abundant in warm, humid climates. Wuchereria bancrofti's habitat. Wuchereria bancrofti mainly inhibits the lymphatic vessels and lymph nodes of humans, where it causes lymphatic filariasis. It's transmitted by mosquitoes, with different species serving as vectors in various regions. The primary vectors include Culex fasciatus, Anopheles mosquitoes, and certain Aedes species. So now we'll talk about Wuchereria bancrofti's immunity. A parasitic worm that causes lymphatic filariasis, a neglected tropical disease. Immunity against it is not well understood, as repeated exposure doesn't confer significant protection. However, some studies suggest that individuals living in endemic areas may develop a degree of immunity over time, possibly due to a combination of factors including acquired immunity and genetic predisposition. Morphology. Adult worm is long, cylindrical, slender, and smooth with rounded ends. It is white in color and almost transparent. The body is quite delicate, making removing it from tissues difficult. It has a short cephalic or head region connected to the main body by a short neck, which appears as a constriction. Pathogenesis and clinical features. Causative agent of lymphatic filariasis is transmitted to humans through the bite of infected mosquitoes. Once inside the human body, the larvae migrate to the lymphatic system, where they mature into adult worms. So here are some signs and symptoms and diagnosis of Wuchereria bancrofti. So signs and symptoms are fever, swelling of the limbs, especially legs and genitals, lymph node enlargement, and lastly skin thickening and deformities. Diagnoses are blood test, antigen test, and lastly is molecular method. So here are the treatment or prevention and control. The recommended drugs for treatment are dethylcarbamazine and ivermectin in combination with albendazole. Both DEC and ivermectin are effective in killing the microfilariae. However, higher doses are necessary to kill the adult worms. Prevention and control. The WHO Division of Control of Tropical Diseases recommends mass treatment in endemic areas. In the Philippines, a filariasis control program was implemented in 2001, which entailed mass treatment in endemic areas using a combination of DEC and albendazole. This resulted in the elimination of infection in some endemic areas. Other measures include the use of mosquito nets and repellents, the use of insecticides to control the mosquito vectors, wearing of protective clothing, and throughout health education of the population.